Welcome day to we're shedding light on a less common but important eye condition, fungal conjunctivitis. While bacterial and viral conjunctivitis are more frequently discussed, understanding fungal infections is crucial for proper diagnosis and treatment, and ultimately, safeguarding your vision. Fungal conjunctivitis, as the name suggests, is caused by a fungal infection of the conjunctiva, the clear membrane that covers the white part of your eye and the inner surface of your eyelids. Several types of fungi can cause this infection. Common culprits include species of Aspergillus, Candida fusarium, and less frequently Sporothrix. These fungi are often found in the environment in soil, plants, and decaying organic matter. Infection usually occurs when the eye is directly exposed to these fungi, most commonly through trauma, like a scratch from a plant or exposure to contaminated soil. Contact lens wearers are also at a slightly increased risk, especially if proper hygiene is not maintained. Let's delve into the pathophysiology. When fungal spores enter the conjunctival sac, they can adhere to the conjunctival surface. If the environment is favorable, meaning the eye's natural defenses are compromised or weakened, such as after injury or due to pre-existing conditions, the spores can germinate and begin to multiply. The fungus then invades the conjunctival tissue, triggering an inflammatory response. This inflammatory response involves the release of various chemical mediators, leading to redness, swelling, and discharge. In severe cases, the infection can spread deeper, potentially affecting the cornea and even leading to more serious complications. Fungal conjunctivitis is relatively rare compared to bacterial or viral conjunctivitis. Its prevalence varies depending on geographic location and environmental factors. It's more commonly seen in tropical and subtropical regions where humidity and exposure to plant material are higher. Agricultural workers, gardeners, and individuals with compromised immune systems are at a higher risk. Cases are also more frequent in areas with poor hygiene and sanitation. While not a widespread public health concern, understanding the epidemiology helps identify at-risk populations and implement appropriate preventative measures. The signs and symptoms of fungal conjunctivitis can vary depending on the type of fungus involved and the severity of the infection. Common symptoms include redness of the eye, a gritty or foreign body sensation, excessive tearing, pain or discomfort, and sensitivity to light, also known as photophobia. A key distinguishing feature, although not always present, is the presence of thick, stringy discharge that may be white or yellowish in color. In some cases, small, raised bumps or lesions may be visible on the conjunctiva. It's important to seek prompt medical attention if you experience any of these symptoms, especially if you suspect a fungal infection. Diagnosing fungal conjunctivitis can be challenging as its symptoms can mimic other types of conjunctivitis. A thorough eye examination is crucial, including a visual acuity test and a slit lamp examination to closely examine the conjunctiva and cornea. To confirm the diagnosis, a sample of the conjunctival discharge or a scraping of the conjunctiva is typically taken for laboratory analysis. This sample is then examined under a microscope and cultured to identify the specific type of fungus causing the infection. Identifying the exact fungus is critical for guiding appropriate treatment. While the specific types of fungal conjunctivitis are broadly defined by the causative fungal species, we can classify them by their clinical presentation. Some may present as acute conjunctivitis, with rapid onset of symptoms, while others may have a more chronic, indolent course. Depending on the depth of infection, we can also classify it as superficial or deep, with deeper infections potentially involving the cornea and other ocular structures. Understanding the clinical presentation helps guide treatment and assess the potential for complications. Treatment for fungal conjunctivitis typically involves antifungal medications. The specific medication prescribed will depend on the type of fungus identified in the laboratory analysis. Antifungal eye drops or ointments are often the first line of treatment for superficial infections. In more severe cases, oral antifungal medications may be necessary to achieve adequate drug penetration and eliminate the infection. In some instances, surgical debridement, which involves removing infected tissue, may be required. Regular follow-up appointments with an ophthalmologist are essential to monitor the response to treatment and prevent recurrence. Preventing fungal conjunctivitis primarily involves minimizing exposure to fungi. Wear protective eyewear, such as goggles, when working in environments with potential fungal exposure, like gardening or agriculture. Practice proper hygiene, including frequent hand washing, especially before touching your eyes. If you wear contact lenses, adhere strictly to your eye care professional's instructions regarding cleaning, disinfection, and wearing time. Avoid using homemade or unsterile eye drops. If you experience any eye injury, seek prompt medical attention to prevent secondary infection. The prognosis for fungal conjunctivitis is generally good with prompt and appropriate treatment. However, Delayed diagnosis or inadequate treatment can lead to complications, such as corneal ulcers, scarring, and even vision loss. Recent research focuses on developing new and more effective antifungal medications with fewer side effects. There's also ongoing investigation into the role of the immune system in fungal eye infections, aiming to identify potential therapeutic targets. Early detection and adherence to treatment are key to achieving a favorable outcome and preserving your sight. Thank you for watching.